Are you silently allowing diabetes to ravage your body every single hour while remaining completely blind to its presence? Let's confront this harsh reality. Long before any blood test is returned, long before a doctor issues an official diagnosis, your body may have already sent urgent distress signals right on your very feet. What I am about to share today is not just information, it is a brand new lens that will help you change how you perceive your health forever. Most of us assume that only needles and laboratories can unmask diabetes. I truly understand why you think that, because over 2 decades of practice, that was the same belief shared by thousands of my patients. I am Dr. Mattheus, and for over 20 years I have witnessed a recurring truth in my office. Your body is always the first to speak up about high blood sugar, long before modern machinery catches on. And the very first messenger to raise its voice is your feet. I am making this content because it breaks my heart to see so many people walk into my office, or worse, the emergency room, with signs that have been visible for months, even years, yet they had no idea what they were looking at. Just last month, I sat down with Robert, a 71-year-old retired man with an extremely healthy lifestyle who felt perfectly fine. He came to see me just for a routine checkup, but before we ran any tests, I looked at his feet and started a conversation. Robert told me quite casually, "My feet have been a bit numb for a while. I figured it was just the inevitable part of aging." Believe it or not, Robert already had 4 of the 9 signs I am about to present. His blood sugar result later came back at 214 milligrams DL. He had been living with diabetes for over 2 years without even knowing it. Today, I am going to show you exactly what I showed Robert. 9 signs currently existing on millions of feet across America that almost no one recognizes for their true meaning. If you have the patience to stay until the final sign, you will discover a simple daily habit that can completely change your health trajectory. According to the American Diabetes Association, 1 in 5 Americans with diabetes is walking in the shadows of misinformation. That's over 8 million people allowing a silent condition to destroy their nerves, kidneys, vision, and their own feet. The good news is that with a blood test costing about $12, you can turn the tide, but first you must know what to look for on your own body. Let's begin this journey together. Sign number 1, tingling and numbness, peripheral neuropathy. This first sign is an experience that nearly all of my patients have encountered, yet the concerning part is how each person finds their own reason to dismiss it. It starts with sensations of numbness, tingling, or a subtle electric prickling right under the soles of the feet. You often tell me, "Dr. Mattheus, my foot just fell asleep because I sat with my legs crossed for too long." And I agree, that occasionally happens in daily life. However, I always pose a decisive question: is this phenomena recurring systematically without a clear physical cause? Because if the answer is yes, we are truly facing a profound biological issue from within. The frequent appearance of numbness or tingling in the lower extremities, medically defined as peripheral neuropathy, is one of the earliest alarms that your blood glucose levels have exceeded safe limits for a long duration. When excess sugar accumulates, it begins to devastate the protective sheath surrounding your nerve fibers. This is a silent and gradual destruction, which is why the majority of you often overlook it. Imagine your nervous system as a complex network of electrical wires in a smart home. Every wire is wrapped in a durable plastic insulation. This coating ensures that commands from the brain are transmitted in the most intact and precise manner to the tips of your toes. When blood sugar stays high, it acts like an acid, slowly thinning and destroying that insulation. The wire may still carry electricity for a while, but the signals become distorted and interrupted. That informational static is exactly the tingling sensation you are feeling. Have you ever experienced unexplained tingling or numbness in your feet? If yes, please comment number 1 below for me. According to data from the American Diabetes Association, this condition affects nearly half of all people living with diabetes. This is one of the most common systemic complications, and the general trend is that it always begins to manifest in the feet. The reality is that right now, tens of millions of Americans are living with these tingles, but regard them as an inevitable part of aging. I urge you not to fall into that trap of misinformation. My daily recommendation for those over 60 is to maintain a habit of walking for 20 to 30 minutes every single day. Remember, this is a relaxed walk to activate circulation, not a strenuous jog. Gentle movement is the best medicine to promote blood flow that nourishes and regenerates damaged nerve endings. At the same time, show love for your body by cutting down added sugar in your diet immediately. Do not wait until tomorrow. Start today to protect the clarity of your feet. Sign number 2, burning feet at night. This second sign is often described by my patients as the most mentally exhausting experience of all, primarily because it doesn't strike during the busy daylight hours. Instead, it waits until the dead of night when you are alone and seeking rest, leaving you with nothing to distract from the discomfort. Many of you might attribute this to standing all day at work or the intense summer heat, and occasionally, that may be true. However, when a patient tells me their feet feel like they are literally on fire, especially the moment they lie down, I take that information very seriously. Burning sensations in the soles of the feet at night are a classic early indicator of diabetic-related neuropathy. What is happening inside your biological system is this. The nerves in your lower extremities have sustained physical damage from excess blood sugar, causing them to transmit incorrect electrical signals to your brain. Your brain receives a heat message even though no hot object is touching your feet. This is the result of nerves misfiring randomly. Think of it like a smoke detector in your home with a faulty sensor. The building is not on fire, but the alarm screams anyway because the sensor has lost its integrity. Your nervous system is doing the exact same thing. The burning is not coming from an external source, but from within damaged nerve tissues that are desperately crying out for help. If your feet burn at night like they are on fire, please comment number 2 so we can assist you. Scientific data in the journal Diabetes Care has highlighted that burning foot pain is one of the pioneer symptoms in patients later diagnosed with type 2 diabetes, often appearing 1 to 3 years before a formal clinical diagnosis. I want to guide you through 2 strategic habits to combat this. First, maintain a daily intake of at least 8 glasses of water, approximately 64 ounces. Staying hydrated empowers your kidneys to flush out excess glucose more effectively and supports nerve health. Second, enrich your meals with fiber from greens, legumes, and oats. Fiber acts like a brake, slowing the absorption of sugar into your bloodstream and providing the exact stability that your struggling nerve endings crave. Sign number 3, slow healing wounds and risk of amputation. I need you to truly focus here, as this is when the warning shifts from discomfort to an existing danger. This is the primary reason most people end up in the emergency room. They come to me saying, "Dr. Mattheus, I had a small blister from my shoe 3 weeks ago, but it still hasn't healed." They waited, hoping the wound would close on its own. Typically, small wounds recover, but that rule doesn't apply when blood sugar is high. When blood sugar remains consistently elevated, your body loses its natural healing capacity. Blood vessels throughout the body, including tiny capillaries in the feet, begin to narrow and stiffen. If you have a slow healing wound on your feet, please comment number 2 so we can help you. This condition means oxygen, white blood cells, and tissue-repairing nutrients cannot reach the wound fast enough. The wound just sits there, open, vulnerable, and very slow to close. Imagine watering a garden with a tightly kinked hose. The water is there, but it cannot reach where it's needed. That is exactly what high blood sugar does to foot circulation. Healing components exist in the blood but are blocked from reaching the wound. An open wound that won't close is an infection waiting to happen. The CDC reports that diabetic foot ulcers are the leading cause of non-traumatic amputations in the U.S., with over 100,000 cases annually. Almost all started with a small ignored wound. After bathing tonight, sit down and carefully inspect your feet, especially between toes and heels. If you see any cuts, blisters, or skin tears, clean with mild soap and water, then apply antiseptic and cover it. If it doesn't improve within 48 hours, call your doctor immediately. Do not wait for next week. The limit is only 48 hours. Call your doctor immediately. Now, I won't repeat this for the upcoming segments, but if you have ever experienced or are currently going through the symptoms I'm mentioning, please comment with the corresponding sign number so I can stay fully informed. Sign number 4, hidden skin discoloration. This 4th sign often hides in plain sight, escaping suspicion. Most people pass over it daily without identifying its true nature. It is clearly there, yet the link to blood sugar is frequently ignored. Patients often observe their feet turning darker or deep red, telling me, "I assume it's sun damage," or "My ankles have always been dark." While possible, There is a specific pattern of pigment change, particularly around the ankles, that I always monitor to assess glycemic risk. When circulation is compromised by high blood sugar, the lower legs and feet are deprived of fresh, oxygenated blood. The inevitable result is skin discoloration. You may notice areas turning dark brown, deep red, or even a bluish tint around the ankle region. This is the skin's way of signaling that blood flow here is severely stagnant. In some patients, the epidermis becomes thinner and more fragile, proving the tissues are not adequately nourished. I often say, think of your blood as a delivery fleet carrying oxygen and nutrients. Your feet are at the end of the longest delivery route, furthest from the heart. When vascular paths narrow due to damage, the cargo fails to arrive on time. Starved of fresh oxygen, the skin changes its appearance. This is a visual distress signal if you know what to look for. Research from the Journal of the American Academy of Dermatology indicates these changes can be detected an average of 18 months before a clinical diagnosis. An essential daily habit is taking 5 minutes to rotate your ankles, raise your toes, and stretch your calves every morning. Even these small movements are enough to drive blood toward the feet. Additionally, elevating your legs slightly while resting offers significant circulatory benefits. Sign number 5. Cracked heels and autonomic nerves. The fifth sign often surprises my patients most because of its harmless appearance. Many have lived with it for decades without connecting it to blood sugar issues. Dr. Mattheus, cracked heels in winter are just normal dry skin. I hear this constantly. While common, when heels crack severely in midsummer or no moisturizer helps despite your efforts, it is a completely different story. High blood sugar directly impacts the autonomic nerves, responsible for controlling involuntary body functions. One task is coordinating skin moisture and sweat glands. When these nerve fibers are damaged, the regulation system in the feet stops functioning, causing the skin to lose natural hydration from deep within. External lotions cannot fix this root cause. Imagine your skin as a protective wall that needs sealing. When autonomic nerves weaken, the mortar between cells crumbles, creating deep fissures. These cracks are not merely cosmetic, they are wide-open gateways for bacteria and infection. In a foot with poor circulation, infection can become extremely dangerous quickly. I have treated patients with cracks deep enough to bleed, despite using lotions for 2 years without effect. This is not a skin disease, it is a neurological issue. The American Podiatric Medical Association identifies chronic heel cracking as a key indicator of autonomic neuropathy in seniors, directly linked to prolonged high blood sugar. This is a sign of severe nervous system stress. Moisturize your feet nightly with specific creams or coconut oil, focusing on soles and heels, but strictly avoid the spaces between toes to prevent fungi. Also, drink 8 glasses of water daily as skin requires hydration from both inside and out. I want to pause here. We have covered 5 signs, and I want to ask you sincerely, have you noticed any of these in yourself or your loved ones? If the answer is yes, even to one sign, please share in the comments below. I read every contribution on this channel to better understand your situation. If you find this useful, hit the like button to spread this value to other seniors in need of help. Sign number 6. Swollen ankles and indicators from the kidneys. Let's continue this journey. The 6th sign carries a medical weight far more serious than you might imagine, as it is not merely a story of your feet, but a status report on your renal system. Most of you, when encountering this, tend to reassure yourselves with reasons like, I sit at the office all day, or my job requires me to stand for too long. I want to state clearly that occasional swelling due to activity is perfectly normal. However, if your feet and ankles fall into a state of persistent puffiness and leave deep sock indentations every evening, the portrait of your health has completely shifted into a different dimension. Prolonged high blood sugar directly devastates the filtration units of the kidneys. The kidneys act as the coordination center for fluid balance throughout the body. When this function is impaired by years of glucose attacks, excess fluid is forced to the lowest part of the body by gravity, specifically the feet and ankles. This phenomenon, medically termed edema, is clear evidence that your blood filtration plant is operating under overwhelming pressure. When filters are damaged, fluid congests with no outlet other than downward. If you press a finger into the swollen area and see an indentation remain for several seconds, that is pitting edema, a red flag signal you must never ignore. Data from the National Kidney Foundation indicates that diabetic kidney disease affects about 1/3 of adults with the condition, and lower extremity edema is often the first peripheral indicator that kidney function is being compromised. My advice is to elevate your legs higher than your heart level by a few inches on a pillow while resting. This action helps drain accumulated fluid back toward the center of your body. Additionally, initiate a revolution in your diet by cutting down sodium. Salt is the primary agent causing water retention and makes edema significantly worse. Read labels carefully, as canned goods often contain massive amounts of sodium. If the swelling is new or shows signs of worsening, notify your doctor at your next appointment rather than waiting for it to become a larger medical disaster. Sign number 7. Electric shock pains and signal distortion. The 7th sign is often the subject of the most common misdiagnoses I have witnessed. Men in particular tend to live with it and mask it with painkillers for years before discovering its true nature. I have heard hundreds of similar stories. I've been taking ibuprofen to kill the foot pain for months because I thought it was arthritis or an old sports injury. While that guess might be right, in many cases the source of the pain lies in a realm that standard anti-inflammatory drugs can never reach. When the nerve network is ravaged by chronic high blood sugar, they don't always fall into a state of silence. Instead, they can become hyperactive. Rather than losing sensation, these nerve fibers begin firing random, intense electrical pulses that your brain decodes as agonizing pain. You might feel like you're being stabbed by a sharp object, experiencing an electric jolt, or having a heated needle pierce your foot. This phenomenon typically peaks at night when your other senses are no longer distracted. Think of this like a car alarm damaged after a fender bender. It keeps screaming without any intruder. That is exactly how a damaged nerve operates. It sends false alarm signals to your brain. This pain is real, but its root cause is neurological dysfunction rather than mechanical tissue injury. Overusing ibuprofen does not help regenerate the nerve. In fact, it is merely the act of masking an urgent message your body is struggling to send. A study in the New England Journal of Medicine confirms that painful diabetic neuropathy affects about 25% of patients and is frequently mistaken for age-related joint conditions. I recommend taking 5 minutes every morning to stretch your ankles and feet while still in bed. Rotate your ankles and stretch your toes to awaken blood circulation. In the evening, perform a gentle massage for about 3 minutes using circular motions along the sole. These small actions are the gratitude your nerves are longing to receive. Sign number 8. Cold feet and a clogged heating system. The 8th sign is the indicator that tells me exactly how far things have progressed. When I observe this in a patient, I know the clinical damage is no longer in its infancy. Most often, the initial reaction I receive is dismissal. Dr. Mattheus, I've had cold feet my entire life. They joke about needing electric blankets for 30 years. I laugh with them, but then I ask a diagnostic question. Are your feet cold even in the July heat? Are they still freezing under 3 heavy blankets? That is the moment my professional concern begins. Persistent cold feet, regardless of the ambient temperature or external support, is clinical evidence that the circulation in the lower extremities is significantly compromised. Your blood vessel walls may have stiffened or narrowed to the point where warm blood no longer has the volume to reach the tips of your toes. Imagine your vasculature as a heating network with pipes running to every corner of a house. When these pipes are blocked or narrowed by high blood sugar, the warmth will never reach the furthest rooms. That room stays frigid no matter how hard the central furnace works. This cold is not about the weather, it is about a failure in the delivery system. The American Heart Association has identified that peripheral artery disease, resulting from narrowed vessels, affects over 8 million Americans, with diabetes being the primary risk factor. Cold feet are one of the earliest and most consistent symptoms of this condition. The optimal response here is a 30-minute brisk walk every day. This is not a leisurely stroll, but purposeful walking combined with arm swinging to force circulation down to the lower limbs. This action strengthens vessel walls and can potentially reverse some of the early narrowing. If 30 minutes feels overwhelming, start with 10. The vital thing is that you must start today. Sign number 9. Loss of leg hair. The silent signal. The 9th sign is something rarely discussed publicly or featured in patient brochures. It is a signal that most people and even many doctors frequently miss. However, once you are aware of it, You will never be able to unsee it. During examinations, when I look at the lower legs and tops of the feet, I often notice a distinct absence of hair follicles. Patients usually only realize it when I point it out, and that is the core issue. A signal so quiet it is easily ignored, yet it carries immense medical weight. Hair follicles are like living organisms that require a constant supply of oxygen and blood to maintain growth. When the circulatory system is weakened by long-term high blood sugar, the follicles in the leg region are starved. Over time, they lose the capacity to produce hair and eventually disappear entirely. This hair loss is tangible proof that the blood vessels have been ravaged for years. Think of hair follicles as small plants in your garden. If the irrigation system fails, the plants don't die instantly but gradually fade away. The absence of leg hair is the message your body is sending about the health of your vascular network. Research in the journal Diabetes Obesity confirms that hair loss on the lower extremities correlates significantly with peripheral vascular disease. It is a reliable indicator that specialists always look for. Immediately after this video, I want you to carefully check your lower legs and the tops of your feet. If you see hair thinning unusually or missing entirely compared to other areas, schedule a blood glucose test this week. In the US, this test costs approximately $12 at certified labs and is typically covered by Medicare. For just $12, you can completely change the trajectory of your health. We have covered a vast amount of information today. These 9 clinical signs represent 9 precious opportunities to seize control of your health before complications have a chance to seize you. I want to be profoundly honest with you from a physician's perspective. One of the most difficult moments in my professional life is sitting across from a patient who has endured every single one of these signs for 2 full years and is only now discovering the reason why. It wasn't because they didn't care. In fact, they cared deeply. They simply lacked the necessary information. Now, you possess that information, and I am asking you to do just one thing. Only one. Tonight, before you go to bed, sit down and examine your feet. Take exactly 30 seconds. Inspect the skin. Look carefully between the toes. Feel for any numbness, and check for any wounds that shouldn't be there. 30 seconds. That is all I am asking of you. If you observe or feel anything on this list, please call your physician tomorrow. Not next week, but tomorrow. Because the earlier you detect this, the more completely it can be managed in most cases through dietary shifts, a daily walk, and an informed conversation with your doctor. You have worked incredibly hard for the life you lead, for your independence, your vitality, and your ability to pursue what you love. Do not allow something as manageable as blood sugar to take any of that away from you simply because no one told you what to look for. Now you know. If you found this meaningful, please share this video on social media right now. Tag someone you cherish, a family member, a friend, or a neighbor. You might be gifting them something they didn't even know they needed. For more conversations like this, I post a new video every week on this channel, Kidney Health 365, focusing on essential health topics for life after 60. These are the medical insights most people never hear outside of a doctor's office. Subscribe and bring your loved ones along for the journey. I am Dr. Mattheus. Stay aware, stay proactive, and take care of those feet. I will see you in the next video. To stay connected, please subscribe. Thank you for your time.